love working from home. I am doing orthodontic treatment. I am monitoring it for my patients, and let me show you how. Hi guys, today I'm doing dental monitoring for a class 3 case. So let's go to the first image. So this is the patient's occlusion in 2020 when they first started treatment. Since then, they've had orthodontic treatment as well as orthognathic surgery. So they've had maxillary advancement and mandibular setback. And as you see here, we're kind of now finishing post-surgery. The occlusion is just coming together. We're also creating some space for those lateral incisors on both sides. So this is just a fantastic way to continue monitoring my patient virtually. So I can see the aligner fit. You can see how it's fitting as they're going through their treatment. And I can also see any discrepancies. So I can see we're getting a nice space here for those lateral buildups. The occlusion's looking good. Class 1 canines. We're also seeing development of a black triangle, which makes me want to do some interproximal reduction to make that contact point a bit broader so that we can reduce that black triangle somewhat. So a fantastic way. You can see how compliant the patient is as I scroll through. They've done all these scans. They've been very compliant throughout treatment. A lot of times compliance is dictated by the doctor-patient relationship. And we know that from a lot of compliance studies. In fact, it's not about their socioeconomic status. It's not about their education level. It's not even about the age. It's mostly about the doctor-patient relationship and how you educated and engaged that patient throughout treatment. So pre-surgical, you can see we were basically just correcting of spin, the lower arch. We were just leveling the teeth, and then the surgery was done to jump the bite. I love virtual orthodontic appointments. I see them as a supplement. It makes my doctor journey through a patient's treatment so much more pleasant, so much more informed. Lastly, I also love this morphing feature that is a part of dental monitoring. Many of my patients love this feature in their app, and it motivates them. They can see the changes.